deep. As a nurse, the outcome you want is a healthy baby and a healthy mother. Now, it's of no use when you have a mother in labor and later get a stillbirth. And it's even worse when you lose the mother herself.
Some staffs, they had learned it in college, but now coming to practical use, some were having challenges with charting the findings, like after observing a mother in labor. And some of them is like they really didn't know that it is a very important tool in labor management.
And the other thing is that there's field for compliance rather than to help monitor a mother.
I'm supposed to join the 2 cervical dilatation readings and the 2 descent readings. If I had like 10 mothers or 15 mothers in labor, this would be so hectic for me.
The world is moving towards technology right now. Everything is being digitized, and we thought it was wise we digitize the labor ward so that we are able to improve monitoring of labor. And we looked at the way the paper-based partograph is used. We thought the ePartograph would help solve some of these problems. The ePartograph is a digitized version of the partograph. It is an application that is installed in a tablet and is used to monitor women in labor. First, we had to sensitize the county health management team so that they understand what the project was all about. Then we had a sensitization for all healthcare workers, just to let them know that we want to improve the paper-based partograph to a digitized version. So at the beginning, we had a training on paper partograph so that we are at the same page and we see the understanding level of the nurses and the healthcare workers on the paper partograph.
Select her, cervical dilatation 6. The descent of the head, I could feel 3/5 out. So not anything special. With paper-based partograph, it's been a tough job trying to remember that after 30 minutes, I'm supposed to check the fetal heart rate of mother A. 20 minutes later, I'm supposed to be taking the temperature of mother B. And 5 minutes from now, I'm supposed to be taking the blood pressure of mother C. Now with the ePartograph, all the mothers are on one gadget.
And there are reminders like the fetal heart rate after every 30 minutes. There is that reminder. If it is not taken, a reminder comes up to me.
You see, the system is already reminding me that now I'm supposed to take this reading now that I've admitted her. Because I've done that, I want to capture the same here. I want to capture the fetal heart. It was 138, 138. I take.
When a client is killed in a facility, gets a mother in labor, and the particulars are put in the ePartograph, I'm able to see it. So you're able to continue following up that client. So if it is something is going wrong, there are so many alerts, you're able to call a colleague and talk to her. So if it is turning out not to be right, a decision can still be made from 3 points, because the in charge of the facility is also seeing it, I'm seeing it, and also at the county, somebody is also able to see what you are doing far away in your facility.
So in case of a problem, the manager is able to also help in the intervention. If you are to get an ambulance, the manager will be able to see that I have a mother who needs an intervention. So it improves decision making so that you're able to provide quality of services.
Now I'm waiting for the next contraction so that I can time it and plot the same on our ePartograph. So if you're not okay with the progress, you arrange for referral. Now it's always been hectic because you have to make phone calls to the receiving facility, you have to make phone calls to your in charge to prepare to transfer a mother from your facility to facility B. But at the moment it's been easier since you can initiate transfer out of your client on an ePartograph. The moment you key in you want to transfer out, you select the facility you want to transfer to.
Once you click on referral, the ePartograph goes there. So you're on the way coming with the client, but already they have a picture of what has happened to that mother and what has happened to that labor. So they can they'll be waiting for you while prepared.
You can get the client maybe from Hasoko, is supposed to be referred to Bungoma. And Bungoma, they're not able to receive the client maybe because there's no doctor or a certain situation. Bungoma will be alerted early, there's a client from Hasoko coming to Bungoma. And if there's a reason why they can't receive the client, they have to inform Hasoko team. They'll call back and inform them, we are sorry, this client you can't bring to Bungoma, can you take the client to a certain referral site? So it avoids the other delays along the way when they're referring this client.
We have been having high maternal deaths and high neonatal deaths. And the program for Save the Children that is in Bungoma was actually started because of the health indicators that were poor, especially maternal and neonatal deaths. And this arises because of people are not able to make decisions at the right time. So with the ePartograph, if we are able to make decisions at the right time and act appropriately, then we will reduce maternal deaths and neonatal deaths.
There's a big difference between the facilities that are using ePartograph compared to those ones that are using paper partograph. In that facilities that are using ePartograph, at least quality of care is much better because we can monitor the client, we can discuss with the team what has happened, we can help to avert the maternal deaths.
Before we started using ePartograph, the last time I think we were called in a meeting, we had 10 fresh SBs, stillbirths. But after we started using ePartograph, I think the last time we had 4.
Just one more push na natoka. Misikia?
We want to provide quality care, especially to mothers in labor, and that is where the main gap is. One of the problems is shortage of staff. And with the ePartograph, a staff can handle like 6 mothers at the same time, and you don't have to forget because you are reminded. But we also want the partograph to be integrated in other medical electronic medical records so that it is part and parcel of all the medical records within the facility. And we know that it can help our healthcare workers monitor mothers better if it is adopted countrywide.